Good afternoon, dear chairs, dear audience. I would like to share my progress in my PhD work, which name is The Role of Chronic Systemic Inflammation in Cardiovascular Pathology. My name is Nina Galdzytska. I am a first-year PhD student here at the CTM and medical doctor. And my team's vision to improve approaches to the diagnosis and treatment of patients with chronic systemic inflammation. To achieve this, we have a mission to study inflammatory biomarkers and their role in patients with chronic inflammation. At the moment, we have two specific goals. Both of them are conducted with the methodology of the systematic review and meta-analysis. My first project is investigating the role of inflammatory biomarkers in developing adverse cardiovascular outcomes in patients with coronary artery disease. So the background regarding this topic is that inflammation has been proven and well known, playing a crucial role in the atherosclerosis and the atherothrombosis. We have no predefined official classification of inflammatory biomarkers, but we have this kind that based on the different molecules. For example, we have cytokines and chemokines, the group of immune-related effectors that are basically the cells, acute phase proteins, reactive oxygen and nitrogen species, and others. But these biomarkers wasn't involved in the evaluation of in the routine clinical practice for the prediction of cardiovascular outcomes. Therefore, our aim was to use these inflammatory biomarkers as a risk assessment. Here you can see the biomarkers that nowadays, based on the recent meta-analysis and systematic reviews, are involved in the coronary heart disease, and hopefully we can analyze most of them. So our clinical question is, do inflammatory biomarkers play a role in major adverse cardiovascular events in coronary artery disease patients? For this, we will use the PFO framework, where we have two subgroups of the population, patient with chronic coronary heart disease and patient with acute coronary heart disease. Our factor is inflammatory biomarkers, and our main outcome is MACE, that a composite of mortality, acute coronary syndrome, heart failure hospitalization, revascularization, and stroke. Our hypothesis is that patients with the high level of inflammatory biomarkers have high risk of the MACE. The clinical implication of this study will be improvement in the diagnosis and risk assessment of patients with coronary heart disease. We have conducted the systematic search in 3 databases in November, and this is our search key that contained 2 domains. First one is possible biomarkers, and the second one is our population. This is our flowchart of the selection. This is a huge piece of case nowadays and very fancy topic. Therefore, we start from more than 40,000 articles. And after the duplicate removal and the title abstract selection, now we're working with 2,394 articles. This is my current progress. I already went through more than 600 articles, and it's a little bit more than 26% of our pool. Regarding my second project, which is investigating the role of inflammatory biomarkers in the development of in-stent restenosis in patients underwent percutaneous coronary intervention that started in September this previous year. So in the United States and in general all over the world, the percutaneous coronary intervention is a gold standard for the treatment of patients with acute coronary syndrome. And in the United States, more than 900,000 these interventions performed every year. Therefore, we need to investigate how the biomarkers involved in the process of restenosis, because it's quite high. Still, it's from 7 to 10%. According to different literature. So the role of inflammation also theoretically proved, and on the picture you can see the pathway of this process. And this is also very important because this inflammatory process is a modifiable pathogenic factor, and we can influence on that. So our aim to investigate the assessment and elevation of the inflammatory biomarkers levels and recurrent restenosis after the PCI. The clinical question is, do inflammatory biomarkers increase the risk of in-stent restenosis in patients underwent percutaneous coronary intervention? We also use the PFO framework. We have patients, population underwent this procedure. We have inflammatory biomarkers as a risk factor, and we have two outcomes. The primary, it's incidence of in-stent restenosis, and the secondary, it's MACE, that also a composite outcome. Our hypothesis is that patients with high levels of inflammatory biomarkers have higher risk of in-stent restenosis after PCI. I had conducted the preliminary research. I want to share with you a few key articles. The first one, the serum resistance. So I choose one biomarker and trying to show you that is a feasible topic. We have some strengths and limitation, of course. So the strength is that we have a follow-up period for this population. We have pre-procedure serum levels of the resistant that is important, but we have some limitation, a small number of patients, unfortunately, and just some of this patient has bare metal stent. The second key article have just bare metal stent that is strong, and the 6 months follow-up as well. Limitation is that we have concomitant disease, it's patient with diabetes mellitus, and also the small number of the patients. There were some meta-analyses regarding the topic of restenosis, but mainly their study just influence on the CRP. They also have small sample size, only observational studies were involved, and have some confounders. And the recent meta-analysis regarding this topic I found from 2018, but also they were interested just in the CRP levels, unfortunately. So in summary, I have two ongoing projects that I hope I try to finish and submit till February and May next year. And I would like to finish with the quote of the Theodore Roosevelt: "Keep your eyes on the stars and your feet on the ground." Thank you very much for your kind attention.
Thank you, Nina. A really impressive search key and a really high amount of articles you should work on.
Yeah.
My question would be that we know that there are a lot of inflammatory biomarkers, and your dream, your vision is that we should use them to prevent cardiovascular events.
Well, my project is focusing on the estimation, so to understand the risk assessment of this patient, but in the future, maybe for the prevention and for the treatment also could be the goal, of course.
And can you name some of these which are the most suspicious for this role, or which biomarkers that seems to be the most relevant for cardiac events?
Actually, all of them that were listed, it's not all existing biomarkers, but they're all biomarkers that play a role and proved for the patient with coronary heart disease. So there is no more or less important for us. Actually, we start this and conduct this analysis to find which are more important for the future clinical practice. Yes, but as far as I look through the articles, more often founded biomarkers, it's myeloperoxidase, interleukins, 6 especially, tumor necrosis factor alpha, of course, and some others as well.
Thank you very much.
Yeah, if I have a patient after a PCI and DES implantation a month ago, and now the CRP level of this patient is high, what should I go? What should I do? Should I send this patient back to the PCI labs? Or?
No, based on the literature, you should supervise these patients more carefully. You can prescribe for a longer period probably the anti-inflammatory drugs that not existed anymore, but you can prescribe, for example, hypolipidemic drugs that have some indirect effect on that as well. But yeah, this is a huge field that can be the basis for the future investigation of the maybe potential drugs for the treatment and prevention of the in-stent restenosis.
No, just, do you know any data about the sensitivity and specificity of CRP in these clinical settings? Maybe.
Unfortunately, I can't answer this question. I'm pretty sure that they studied the sensitivity and specificity, but as far as it wasn't the primary interest, not the outcome of our interest, unfortunately, I'm not paying attention to that.
Super. Thank you.